Without any delay, I would like to call upon Dr. Molidhar Sharma sir, Professor Emeritus, STMCA would be to take over the session. Welcome to you, sir.
Next is about the arshas. तथा तो अर्शसां चिकित्सां व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः चतुर्विधो अर्शसां साधनोपायः तद्यथा भेषजं क्षारो अग्निः शस्त्रमिति. The possible options of treatment for the arshas are either medicine, bheshaja, or kshara, agni, and shastrakarma. And the indications are very specific, and the specific indications are for the bheshaja, that medicines, achira kala jatani alpadosha linga upadravani bheshaja sadhyani, recent onset arshas with relatively milder symptoms and with the little complications or few complications are to be treated with the medicines. Mrudu prasruta avagadhani uchridani ksharena, those which are soft and which tend to bleed and they are located deep inside the body or maybe projected out, then they are considered as indications for the kshara. Important, kshara has an indication only in those conditions which are bleeding and soft, which are not yet the coagulated or where the clotting has occurred. That's our fibrous indication. They are not to be treated with the kshara. Whereas those which are hard, karkasha, stira, prutukachnani, agdina, which have become fibrosed and thrombosed and firm in consistency, they are to be treated with agni karma. And tanumulani, uchridani, kledavanti, shastrena, which are pedunculated, hemorrhoids which are pedunculated and which are projected out, they are to be treated with the shastra karma. So indications are very specified and the options of the treatment also are very targeted, and that's very important scientific method of dealing with the diseases and the specific methodology of treatment. तत्र भेषजसाध्यानाम् अर्शसाम् अदृश्यानां च भेषजं भवति क्षाराग्निशस्त्रसाध्यानां च विधानं च अनुपधारय. But the bheshaj the medicines and the principles of the medicine would be based upon the dosha concept. In the current methodology of classification of the practice, these hemorrhoids, of course, those issues we have discussed in detail in the Nidanasthana. But from the current point of view, the issues like those which are internal hemorrhoids and which are not yet coagulated and slightly projecting out, they are the indication for the kshara. And when there is a external or hemorrhoid or which have become thrombosed over the area, they are the indication for either agni karma or the shastra karma. And the which are internal and which do not really produce complications, they are the treatment indication for the medicine. In the current methodology, the guidelines for practice of the dealing with the kshara, as per the standard American Gastroenterological Association, the medical position statement, which is the guideline for the management of the kshara, is or management of the hemorrhoids, are that in all types of the conditions, varieties like grade 2, even complicated conditions, the dietary lifestyle and dietary modification has a major role, which practically majority of the current practitioners do not give attention to. Grade 1 and grade 2 to be treated with the medicines only, medication only, tropical or maybe systemic. And indications for the office-based procedures, that's the minimal invasive procedures like banding or sclerotherapy, they are indicated in either grade 3 or occasionally in the grade 1 and grade 2 even. Grade 1 and grade 2, grade 3 are decided by the same clinical presentation. Grade 1 is when there is a hemorrhoid but which is not really projecting out and it's relatively small and it's only the bleeding. Grade 2 is when there is a bleeding and the mass gets projected out during defecation but gets reduced spontaneously. Grade 3 is when the mass gets projected out during defecation but reduction has to be done manually. Without spontaneous reduction is not possible. Grade 4 is when it is prolapsed particularly permanently and cannot be reduced at all. Now in such conditions again the option would be grade 2 to grade 4, the options would be non-excisional operations, like again same all that your sclerotherapy, banding, etc. Excisional operations are done for mainly the projected. This is the protocol of treatment now, where there is a lot of overlapping. Now, this protocol and guideline, there is a overlapping. Whereas Sushruta's protocol and the classification is a very clear cut and the indications are very specific there. Now, the method of dealing with the hemorrhoids or interventional treatment of arshas, and Sushruta has given an example in case of the Ksharakana. Of course, the similar protocols are indicated in the surgical as well as the Agni Karma, as well as the other preparation parts are concerned. The whole protocol of treating that patient or in an interventional procedure of the hemorrhoids, I would generalize it as interventional procedures of the hemorrhoids are बलवंतम आतुरम अक्षोभि उपद्रुतम उपस्निग्धम परिस्फिन्नम अनिल वेदनाभि अभिवृद्धि प्रशमार्थम स्निग्धम उष्णम अल्पमन्नम द्रवप्रायम भुक्तवंतम उपवेश्य. Now, the selection of the patient is one of the important criteria. The patient should be physically strong, or the fitness of the patient is one of the concerns before you go for any intervention. And of course, the diagnosis of the arshas has to be done. Then, before the treatment, Sushruta says, Parisvinnam Anila Vedana Abhivruddhi Prasmartham, to after the Svedana, then to reduce the possibility of aggravated pain and response to the pain. The response to the pain to be modified, patient has to be given a light food which is warm and small quantity of food having more liquid is to be given. Now, there is a bit of controversy. In Sutrasthana, Sushruta has mentioned Abhuktavata Karma Kurita in the arshas conditions, in the list of those conditions where the surgery or maybe interventions have to be done in an empty stomach. In Sutrasthana, there arshas is one of them. Then it looks like a controversy. The controversy, of course, is not an issue. The issue is the complications which can occur due to consumption of the food prior to the surgery in case of the structures related to the abdomen. If you are dealing with any abdominal surgeries and if the patient is having the food, there is always a chances of the later complication of paralytic areas. But if the patient is given sufficient food prior to the surgery, the pain tolerance will be better. So that option would be depending upon the possible complications, and hence Sushruta gives you both the options. In the present day situation, this may not be a very critical issue because you have the method of the intravenous fluid or intravenous nourishment. Nutrition can be maintained by intravenous drips, and hence keeping the patient nil orally has become a universal rule. Whereas in Sushru's period, this kind of a choice had to be done by assessing the patient's condition and deciding about your priority. So that's about the issue. Then शुचौ देशे साधारणे व्यभ्रे काले समयफलके शय्यायां प्रत्यादित्यगुदम् अन्यस्य उत्सङ्गे निशनपूर्वकायम् उत्तानं किञ्चित् उन्नतकटिकं वस्त्रकम्बलक उपविष्टं यन्त्रणशाटकेन परीक्षितग्रीवासक्तिं परिकर्मिभिः सुपरिगृहीतम् अस्पन्दनशरीरं कृत्वा. Now, the positioning of the patient is another of the important issue. With all that rectal surgeries, the related interventions of the rectal surgeries, the positioning the patient in a proper manner is another of the issue. The most common and preferable position now is lithotomy position. Sushruta also had opted lithotomy position for surgical intervention, and the only difference is now for the lithotomy position you have that fixed stirrups in the table and then you have all the supports there. In Sushruta period that was not there, and hence Sushruta preferred to make the patient lie down on the lap of his assistant, and the chest of that, the upper part of the body is kept on the lap of the assistant, and the leg is flexed and the flexed leg is held by the hands of the assistant, so that the patient would have a lithotomy position, and the height of the table would be dhanasama, to the level of the knees, so that the surgeon can sit and do the surgery. In the present day situation, the surgeon prefers to stand and do the surgery, and hence the height would be up to the level of maybe the hip level. So that's the difference compared to what we do now and what Sushruta had done. And then the patient had to be fixed to the position with the vastra kambala. There may be thick cloths or maybe yantra shataka with some specific instruments which can hold the patient firmly not to allow any undue movement. So, aspandana shariram krutva, patient has to be kept in a fixed position. Then, घृताभ्यक्त गुदाय घृताभ्यक्तं यंत्रं ऋजु अन्मुखं पायौ शनैः शनैः प्रवाहमानस्य प्रणिधाय प्रविष्टे च अर्शो वीक्ष्य शलाकया उत्पीड्य पिचुवस्त्रयोः अन्यतरेण प्रमृज्य क्षारं पातयेत्. Then you have to have a lubricant. The lubricant is with the ghrita. Apply the lubricant over the anal margin as well as apply the lubricant over the anoscope, that proctoscope also, and then gradually introduce that instrument. Now Sushruta had two varieties of the arshayantras. One arshayantra for the examination of the arshas and other arshayantra for the procedure. So when you have arshayantra with the vimukha, two openings at the end, they are used for examination, and the one opening at the end is used for the procedure. Now these issues again we have discussed in Sutrasthana when we have discussed about the arshayantra. So you have to examine, confirm the position of the arshas, and then introduce the yantra which is used for these procedures. Like then Shalakaya Utpedia, the positioning that hemorrhoids have to be, or the arshas have to be projected in such a way into the lumen of the anoscope in such a way that you can have a clean surface to apply the kshara. Then the surface is cleaned and then kshara is applied. पातयित्वा च पाणिना यन्त्रद्वारं पिधाय वाक्शतमात्रम् उपेक्षेत. ततः प्रमृज्य क्षारबलं व्याधिबलं च अपेक्ष्य पुनः आलेपयेत्. Now you have to apply the kshara and wait for 100 matra kala. That 100 matra kala is something like around 70 seconds, 60 to 70 seconds. And you have to observe the signs. The signs would be when the arshas has become properly is affected by the kshara, the color of the hemorrhoid would be changed into pakko jambo kashmiri varnam dagdhe arshansi pittaje bhringamayura kanthavarnam nirdishet brihati pushvarnatam samyak dadde kafarshansi. This is what Dallana says. The color changes. In case of vataja arshas, it becomes pakko jambo varna, that is somewhat greyish color. Pittaje bhringamayura kanthavargam, the color of a peacock's neck, something dark bluish or blackish color. Brihati pushpavarnam samyak dadde kafarsham. See, kafarshas, it will become red color like Brihati pushpa. So the color would be changing according to the situation of the arshas, condition of the arshas. Those which are bleeding ulcers would become somewhat blackish as such. So you have to observe for the color change which suggests a samyak dagdha lakshana. Then tatah pramritya ksharabalam vyadhibalam cha aveksha punaha alepayet. If it are necessary, if one application of the kshara doesn't result in the optimum color change, then you may have to apply it again. Then atha arshah pakvajambo pratikasham avasannam ishat natam abhisameksha upavartayet. Sushruta makes a general statement. Dallana has added some more details about the color changes which can occur. Sushruta says the arshas has to result in pakvajambo varna, the dark blackish color of the pakvajambo varna, and it should be somewhat shrunken. The surface should be shrunken. That's the sign of a proper application of the kshara. Now once this has reached, then ksharam prakshalayet dhanyam dena dhati mastu shukta palam lerva tato yasti madhuku misrena sarpisha nirvapya yantram apaniya utthapya aturam ushnodakopavishtam shitabihi parishincheta ashitabihi ityeke tato निर्वातम आगारम प्रवेश आचारिकम आदिशेत सामशेषम पुनर्दहेत एवं सप्तरात्रात् एकैकम् उपक्रमेत तत्र बहुषु पूर्वं दक्षिणं साधयेत् दक्षिणात् वामं वामात् पृष्ठजं ततो अग्रजम्. Now once the samyak dagdha lakshana has been achieved, the kshara has to be washed up and washed up with some sour tasting substances. Either it could be dhanyamla, or it could be whey water, or the palamla. Some sour substances are used. Very often we use the limbu juice. Now, and then after that, madhuyasti ghrita has to be applied over the area, and then the instrument has to be removed. And the patient has to be nursed in a 6 bath, And sixth bath, Sushruta says, Ushnodakuvishtam, in a warm water, sixth bath has to be given. And during Sushruta's period, there was a difference of opinion. Somebody would prefer cold water also. So, anyway, then once that is done, that protocol is followed, the patient has to be nursed in a post-operative room where the patient, all that protocols of the post-operative care has to be followed. And if at all, in the follow-up, if the arshas has not been completely removed or completely coagulated, then you may have to apply it again. If at all there are more than one hemorrhoids, they have to be treated in an interval of 7 days. All hemorrhoids cannot be managed in a single sitting, so there should be a minimum gap of 7 days between two sittings for the multiple these hemorrhoids. Now, Sushra even says another standard protocol, like if at all there are multiple, the lesions on the right side are to be treated first, and then the lesions on the left side, and then the cristatum on the posterior side, and then the anterior side. Now, of course, this kind of a priority may not have any other practical utility, but it could be only from the point of convenience. Then Vatashtrashma Nimittani Agniksharabhyam Sadhet Ksharaneva Mriduna Pittarakta Nimittani. If it is a Kapha Vata Dvandava condition, Agni and Kshara both can be used. And if it is a similar Pittaja Raktaja Vyadhi where there is still bleeding and the vascular stasis has not occurred, coagulation has not occurred, in that condition, Kevala Kshara can be used. तत्र वातानुलोम्यम् अन्नरुचिः अग्निदीप्तिः लाघवं बलवर्णोत्पत्तिः मनस्तुष्टिः इति सम्यक् दग्धलिङ्गानि. The Samyak Dagdalinga, your optimum result of the intervention is not seen only by the local signs of the color changes. The other systemic signs, like a patient should be able to pass the plates and stools properly, should have a proper appetite, and the hunger also, should feel lightness and feel comfortable. That comfort of the patient is the criteria to decide like whether your treatment has gained optimum results or not. If at all there is a over utility or there is a excess of the kshara action, in that condition, atidagte gudavadaranam dahaha murcha jwaraha pipasa shonukadu pravritti tannimitascha upadravaha bhavanti. In atidagda conditions, if there is a excess of kshara action, it results in incontinence, gudavadaranam, incontinence, dahaha murcha, burning sensation, unconsciousness, jwaraha, all the signs of sepsis would occur. Or it could be bleeding, and complications of the bleeding could be the complications. Then in Alpa Dagdha or Hina Dagdha, Dhyama Alpa Vranaka Kanduhu Anilavai Indriyanam Aprasadaha Vikarasya Ashantihi Hina Dagte. In Hina Dagdha condition, the wound becomes indurated and the lesion would remain as such and get indurated, itching and the improper movement of the bowels and bladder and discomfort to the patient would be occurring as the clinical signs. Mahantija pranamada chitvada hetu nirgatanja atyartham doshapurnani yantradvina. If the size is quite huge and application of the kshara or the agni karma is not possible, Sushruta recommends a partial reduction of the size by a surgical excision followed by agni karma or kshara karma. And if at all the lesions are not visible to the naked eye and it's all embedded in and cannot be protruded out, in that condition, if at all it has been protruded out and then you are seen projected out as a continuously prolapsed mass without the yantra. Yantra is not necessary when you have a mass which is visible directly and is protruded out. Swega abhyanga sneha avagaha upanaha visravana alepa kshara agnishastri upatireta. The other options could be Swegana, Abhyanga, Snehana, all these protocols could be used depending upon the your presentation. Pravraktaraktani Raktapitta Vidhanena, if there is more bleeding, then all the protocols of Raktapitta chikitsa can be followed. Bhinna Purishani Atisara Vidhanena, in patients who have loose stools, it should be with the Atisara chikitsa. Now, how this can be adopted in the current practical, at the end of this section, I will just suggest about how I deal with it. Baddhavarcham if snehapana vidhanena udavarta vidhanena. If the patient has severe constipation, then the snehapana or udavarta chikitsa have to be followed. Yesha sarvasthanagatanam arshasam dahana kalpaha. So, The primary protocol could be either the interventional procedure for like Agni Karma, Shastra Karma or Kshara Karma, but the other option would be based upon the dosha lakshanas. You have to modify the treatment. That's the principle there. Then asagya, darvi kurchaka shalakanam anyatamena ksharam payeta. The application of the kshara could be done by a spoon-like instrument, darvi, or it could be by a brush like kurchaka, or it could be a simple rod, shalaka. So that gives you the quantitative measurement. Either spoon applies more kshara, kurchaka lesser, shalaka still lesser. So choice of collecting the drug and the quantity of the drug can be measured by these options. Brashabudasya bina yantrena ksharadi karma prayojita. Same is repeated. Brashabudah is where there is a prolactic condition. Without yantra, it can be, all the procedures can be followed. Sarveshu ja shani shastika yapabodhuma annam sarpisnigdha upasevayate payasa nimba yushena patola yushena va yatha dosham shakehi vastuka tanduliyaka jivanti upodika ashwabala balamulaka पालंकी आसन चिल्ली चिच्चू कलाय वल्लीभि अन्यैव यच्च अन्यदपि स्निग्धम् अग्निदीपनम् अश्वघ्नं सस्यमूत्रपुरीशं च तदुपसेवेत. The food has to be given options of the food like either shani shasti or godhuma or with the ghee as well as the vegetables which can be used, the list of the vegetables which are preferred. But in general, anything which is snigdha and agnidipana and Susamutra Purisha, which facilitates the stools, passage of the stools and the urine properly, and which improves the digestion and which has facilitates the smooth movement of the organs, they are to be preferred. So dietary preference would be which is light, easy to be digested, and gives sufficient nourishment and facilitates proper passage of the stools and flatus. दग्धेषु च अर्षसु अभ्यक्तो अनल संरक्षणार्थम अनिल प्रकोप संरक्षणार्थम च स्नेहादीनां सामान्यतः क्रियापदम् उपसेवेत. In general, in all the patients of arshas after the surgery or after the intervention, maybe Agni or Shastra or maybe the Kshara, in the postoperative period, to prevent the Vata Prakopa, the general protocol of Snehana Svedana have to be followed. विशेषतस्तु वातार्षस्सु सर्पींषि च वातहरदीपनीय सिद्धानि हिंगादिभिः चूर्णैः प्रतिसंसृज्य पिबेत. पित्तार्षस्सु पृथक्पर्ण्यादीनां कषायेन दीपनीय प्रतिवापं सर्पिः. शोणितार्षस्सु मञ्जिष्ठा मुरुङ्ग्यादीनां कषाये पाचयेत. श्लेष्मार्षस्सु सुरसादीनां कषाये. The other medicines which can be given would be depending upon the dosha involvement. In Vatajarshas, it could be Vadhara Dipaniya Dravya, Pittajarshas Pittahara, Kaphajarshas Kaphara Dravyas, or Raktajarshas, Rakta Prinana Aushadis are to be given. And the examples given are the same. Upadravam Shetha Somupacharete. If there are any complications, they have to be treated based upon the Rakshanas. Parancha Yatnam Asaya Gude Ksharagni Shastrani Amjare, Tadvibhrahmati, Shandhya, Shopa, Daha, Madam Murcha, Ato, Panaha, Atisara Pravahanani Bhavanti, Maranam. The interventional protocol of the hemorrhoidal management should be very careful. If there is a wrong approach, if the approach is not proper, it can result in multiple complications, and the complications are listed as impotency, local swelling, and septic complications like Daha Madam Murcha or Atisara Pravahanani. Atisara, there could be diarrhea-like complications, or there could be constipation also, or even death also can occur as a complication. Now, this is about the whole intervention protocol and step-by-step method of dealing with the interventions. Then, Yantra Pramana, the next would be about the Yantra, the description of the Yantra. Of course, description of the Yantra we have already referred to in the Sutrasthana with the same description, again repetition. तत्र यंत्रं लौहं दान्तं शार्ङ्गं वा वृक्षं वा गोस्तनाकारं चतुरङ्गुलायतं पञ्चाङ्गुलपरिणाहं पुंसां षडङ्गुलपरिणाहं नारीणां तलायतं तद्विच्छिद्रं दर्शनार्थम् एकच्छिद्रं तु कर्मणि एकद्वारैः शस्त्रक्षाराग्नीनाम् अतिक्रमो न भवति छिद्रप्रमाणं तु त्र्यङ्गुलायतम् अङ्गुष्ठोदरपरिणाहं यद् अंगुल अवशिष्टं तस्य अर्धाङ्गुलात् अधस्तात् अर्धाङ्गुलोच्छ्रित उपरि वृत्तकर्णिकम् एषः यन्त्राकृतिसमासः. We have detailed all this in the Sutrasthana, but again repetition. Instruments could be prepared out of either metallic or maybe the ivory or maybe the horns of animals, or it could be wooden material which has the shape of Gostanakara or cow's udder. That's exactly the same of the shape of the proctoscopes as we use now. And the length of that proctoscope is chaturangulayatam, 4 angulars, and panchangula parinaham, width is 5 angulars. Shadangula parinaham narinam, for the women it's the 6 angular. Of course, there is no other anatomical difference, but the only issue is in the females, the anal opening is more stretchable because you do not have a rigid structure like a prostate on the anterior side, whereas in the males it is less stretchable. And that's why Sushruta has prepared a wider instrument in the females than in the males. All these issues again we have discussed in the Suprasthana. Vichitram darshanartham ekachitram tu karmani. To visualize the terminal end of the proctoscope would have 2 openings, which gives you a wider access. But when it is the procedure, the ekachitra, 1 opening is preferred because when you have only 1 opening, the remaining areas would be protected. Hence, the intervention would not produce more collateral injuries. And the size of the opening would be triangulayatam musthodar parinaham, 3 angulars in the diameter, and the opening would be size of angusta, the thumb as such. Then in the last half of the last 3/4 of the instrument, the proximal side, there has to be parivritta karnika, an edge which prevents the proctoscope from getting lost in the anus. You will have a widened edge which prevents that projecting out. Then that's about the yantra as such. Then the other protocols of the treatment are either alepa, local application. Local application would be options of the substances which can be applied for the arshas are snuhi kshirayuktam haridra churnam alepa pratamaha, snuhi kshira with haridra, or kukkuta purisha gunja haridra pippali churnam iti gomutra pisto dvitiyaha, with the kukkuta purisha, the pieces of the hen, and gunja haridra etc., tikshna dravyas. That could be the second option. The other option would be danti chitraka suvarchika langarikal kova gopitta vishta tritiyaha. The third option would be danti chitraka suvarchika etc. Then pippali saindava kushta shirisha palakalka snuhikshira pisto arkakshira pisto va chaturthaha. A fourth option would be pippali saindava etc. Then kasi saharitala saindava ashwamala vidanga puti kritavedhana jambu अर्क उत्तम अरणि दंति चित्रक अलर्क स्नुहि पयस तैलम विपकम अभ्यंजन अर्षशादयति. The irritant substances which can be applied over the hemorrhoid, something like the sclerotherapy. In the sclerotherapy now, we inject the substances into the veins, whereas Sushruta had preferred to apply the irritant substances over the hemorrhoids so that they get coagulated and the bleeding would not occur. The whole hemorrhoid becomes fibrous. So options are the similar. अतः बेशे साध्येषु अर्षेषु अदृश्येषु अर्षसु उद्योगान् यापनार्थं वक्ष्यामः. For the भेषज साध्य, the medicinal uses, choices of the medicines, the medicinal combinations and simple protocols of the medical treatment is suggested, and there one of the option is gudaharitaki, pratah pratah gudaharitikam seveta, and the protocol is something like the rasayana. The option would be brahmachari gomutra drona siddham va haritaki shatam प्रातः प्रातः यथाबलं क्षौत्रेण अपामार्गमूलं वा तड्डलोदकेन क्षक्षौत्रं महरहः शतावरी मूलकल्कं वा क्षीरेण चित्रकचूर्णयुक्तं वा सीधुं परार्थ्यं भल्लातकचूर्णयुक्तं वा सक्तु मन्थम् अलवणं तक्रेण कलशे वा अन्तः चित्रकमूलकल्का अवलिप्ते निषिक्तं तक्रम् अम्लम् अनम्लं वा पानभोजनेषु उपयुज्यते. एषे एव Bharangi, Aspota, Yavani, Amalaka, Gurujishu, Takrakalpaha. So either it could be administration of Gudaharitaki. Gudaharitaki, Sushruta says 100 haritakis have to be consumed with the Gomutra, and the patient has to follow all the protocols as such. Then and it should Apamargamula or Shatavari Kalka or Bhallataka Churna is given. Now, one special preparation which is suggested would be You apply chitraka mulaka kalka over the internal surface of a vessel and then keep that vessel, fill that vessel with the takra, and that can be given. Or that's a takra kalpa. Takra kalpa is considered. Takra is one of the most suggested option, or it's one of the aggressive way in the management of the arshas. पिप्पली मूल च विचित्रक विडंग शुंठी हरिजकृष्ण पूर्वदेव निरन्नोव तक्रम अहरह मासमुपसेवेत another of the local पिप्पली मूल etc. शृंगवेर पुनर्नमा चित्रक कषाय सिद्धं वा पयः कुटिले मूल त्वक्क फाणितं वा पिप्पल्यादि प्रतिवापं क्षौत्रेण महामातव्याधियुक्तं हिंगवादिचूर्णम् उपसेवेत तक्राहारः क्षीराहारो वा. All the medicines are required, but in all the medicines one of the important substance is a takra. Then Kshara Lavanam Chitraka Mula Ksharodaka Siddhan Va Kulmashan Bhakshet. The other food supplement could be Kshara Lavanam Chitraka Mula Ksharodaka Siddhan. Kulmasha is the something like idli. Then Chitraka Mula Ksharodaka Siddham Va Payah Palasha Taru Kshara Siddham Va. Palasha Taru Kshara Siddhan Va Kulmashan. Again, another form of the preparation of the idli. पाटल अपमार्ग महति पराशक्षारं वा परिस्फुटम् अहरः घृतसंसृष्टं कुटज बन्दाकमूलकल्कं वा तक्रेण चित्रकपूतिकनागरकल्कं वा पूतिकक्षारेण क्षारोदकसिद्धं वा सर्पिः पिप्पल्यादिप्रतिवापं कृष्णतीरप्रसृतं प्रकुञ्चं वा प्रातः प्रातः उपसेवेत शीतोदकानुपानम्. These are all the optional suggestions about the diet and dietary supplements and modification of the dietary supplements with the medicines. So, and these also can be practiced, but in the present day situation, to practice these would be quite difficult to make the patient have this kind of a food as such. But if at all that's followed, definitely yes, it will be one of the best options for the prevention as well as management of the hemorrhoids. Yebihi abhivartate agni arshams upashamyanti. So all that protocols which can improve the agni are recommended for the management of the arshas, and once the agni becomes normal, all the arshas can be managed easily. Dipancham muli danti chitrakapatyanam tulam ahritya jala chaturdrone vipachayet tataha padavshishtam kashayam asadya adaya sushitam gudatulaya saha ulmishriya घृतभाजने निक्षिप्य मासम उपेक्षेत यवपल्ले ततः प्रातः मात्रां तायेत तेन अर्शो ग्रहणी दोष पाण्डुरोग उदावर्त अरोचकाः न भवन्ति दीप्तश्चाग्निः भवति. Another Arishta yoga where the kashayas of Dashamulatyandi Chitraka are prepared and they are kept in with the guda, jaggery, and fermented. So a fermentation product is suggested like asava in the management of the arshas. Similarly, Pippali, Maricha, Vidanga, Yela, Valuka, Lodharan, Dvedvepare, Indravarnya, Panchapalani, Kapitam Abhyasya Dasha, Pakya Palanam, Arthaprasaha, Prasto Dhatri Palanam, Yedal Aikadyam, Chatur, Jalachatadrunam Pacha, Padavashesham Parisravya, Sushitam, Gudatula, Dvayana, Ulmishra, Grisabhajane Nikshipya, Paksham Upeksha, Evapalle, Tata प्रातः यथा बलंगो विजेता एत खलु अरिष्टः. Another of the Arishta yoga, Pipadyagarishta. प्रीह अग्निशंग अर्शो ग्रहणी हृत्पांडुरोग शोक कुष्ठ गुल्मोदर कृमिहरः बलवर्णकरष्टेति. That Pipadyagarishta can be used in प्रीह अग्निमांद्य ग्रहणी also. Panduroga, shoka, etc. It has a broader indications. तत्र वातप्रायेषु स्नेह स्वेद वमन विरेचन आस्थापन अन्वासनम् अप्रतिषिद्धम् पित्तजेषु विरेचनम् एवं रक्तजेषु संशमनं कफजेषु शृङ्गवेरकुलत्थ उपयोगः सर्वदोषरं यथोक्तं सर्वजेषु यथा स्वौषधिसिद्धं वा पयः सर्वेषु. The other protocols of the Svedana or Shodhana also are applicable in case of the arshas also. Like Vataja conditions, the Asapana Anuvasana, they are indicated. Pittaja Virechana, Raktaja in Samshamana Chikitsa, Kafaja there the Sringavera Kulatha, etc. are to be used, and the selection of the drug would be depending upon the doshas. But in all that, payaha, the milk and milk products like the curds and so on, they are lassi, they are preferred as such. Atavurdhvam Bhallataka Vidhanam Upadekshamaha. Another Bhallataka Yoga is mentioned, something like a Bhallataka Rasayana, as mentioned in Charaka in the Rasayana Yoga. Bhallatakani Paripakvani Anubhatani Ahritya Tata Ekam Adaya Vidha Tridha Chaturudha Chedayitva Kashaya Kalpena Vipatya Tasya Kashaya Shuktim Anusnam Ghrabhyakta Taludikosta Prata Pratapaseveta Tato Aparahne Kshiram Sarpi Bodhanaityahraha एवम् एकैकं वर्धयेत् यावत् पञ्चतिः ततः पञ्चपञ्चाभिः वर्धयेत् यावत् सप्ततिः प्राप्य च सप्ततिम् अपकर्षयेत् भूयः पञ्चपञ्च यावत् पञ्चेति पञ्चभ्यस्तु एकैकं यावद् एकमिति एवं भल्लातकसहस्रम् उपयुज्य सर्वकुष्ठ अश्व अभिवृद्धिमुक्तः बलवान् अरोगच्छतायुः भवति. Bhallatakasahasra, 1000 Bhallatakas have to be used, and the protocol is you start with one Bhallataka on the first day. One Bhallataka seed has to be cut into 3 or 4 pieces, and then it has to be boiled in water, and that kashaya has to be taken in a moderate warm conditions after applying ghrita into the mouth, and then it has to be taken in and followed by Kshiraha Sarpi Vodhanam. The patient has to take only milk, ghee and the rice. Till it reaches 50, you have to increase one by one. And then after it has reached 50, you have to increase by 5 per day. That's on the 50th day it is 51, 50, but first day it is 55, and the 52nd day 60, and so on. So it has to be increased till 70 are taken in a day. Then once you have reached 70, then it has to be reduced by 5 in a day, 5 pancha pancha yavat pancheti, till it comes to 5, and then by one. This way, Sushruta says you will have 1000 Bhallatakas used. But if you exactly calculate in the same protocol, it comes to 1220. So anyway, there is some error of calculation, maybe, but that's how it is done. But practically, to use this kind of a protocol now is quite difficult, and I don't think that any person in the present day situation will be in a position to eat 70 Bhallataka in a single day and then tolerate it. So I have not done it, and I don't have any practical experience. Divranye uktena vidhanena Bhallataka nishtititam sneham adaya प्रातः शुक्तिमात्रं वैन्दिता जीर्णे पूर्वदाहारः फलप्रकर्षश्च भल्लातकमद्यभ्यो वा स्नेहम् आदाय अपदिष्टदोषः प्रतिसंशिष्टभक्तो निमातम् आगारं प्रविश्य यथा बलं प्रसृतिं प्रकुञ्चं च उपयुञ्जीत तस्मात् जीर्णे क्षीरं सर्पिः बोधनमित्याहारः एवम् आसमुपयुज्य मासत्रयम् आदिष्टाहारः रक्षेत् आत्मानं ततः सर्व उपतापान् अपहृत्य वर्णमान् बलवान् श्रवणग्रहणधारणशक्तिसम्पन्नः वर्षशतायुर्भवति. मासे मासे च प्रयोगे वर्षशतम् आयुषो अभिवृद्धिर्भवति. एवं 10 मासान् उपयुज्य वर्षसहस्र आयुर्भवति. Bhallataka can also be administered in the other way, like Bhallataka Taila, as mentioned in Divroniya. We have discussed that protocol of preparing the Bhallataka Taila in the earlier chapters of Divroniya Adhyaya. And this can be given, the Kshir Taila also can be given for months together, and during that the patient has to take food of milk and ghee and then maybe the rice. And if you use that Bhallataka for a month, then all the diseases will be cured, and the ability to receive the senses will be increased, and the life would be enhanced by 100 years. So if you repeat the same by month, every month would add 100 years to the life, and by using for 10 months, you will be able to live for 1000 years. This is what Sushil said. Practically, whether anybody can survive for 1000 years or not, questionable. So I will not go into that part. Bhavanti chatra yatha sarvani kusthani hatak khadira bijako tathaiva arshamsi sarvani vrikshaka arushkaro hatah haridrayah prayogena prameha iva shodasha ksharagni nativartante tada drishyah budodbhavaha. Bhallataka yoga is considered as one of the most powerful yoga and most efficient yoga in the management of arshas, according to Sushruta. And it's compared to like Khadira in Kushta or Haridra in Prameha. So there every type of the Bhallataka can be managed. Every type of hemorrhoids can be managed with the Bhallataka. घृतानि दीपनीयानि लेह एस्कृतेस्तुराः आसवाश्च प्रयोक्तव्याः वीक्ष्य दोषसमुच्छेदम्. So if not, you may use any of the other substances which are available, like either ghritas or lehas or ayaskriti, asava, any of the materials or the medicines which are available now, they can be used as management. And during the management, patient has survived Begavarodha, Stri Prusthayanani, Utkutukasanam, Yathaswam Doshalam Charnam, Arshas Parivardeta. The patient has to avoid suppression of the physical urges and rigorous exercises and Utkutukasanam, sitting in a sitting in a squatting position or any of the doshal ahara, the diet has to be taken care of. Simplified option of the treatment in Vagbhata about the arshas is Shushkeshu, Bhallatakam Agrimuktam, Vaishajyam Ardeshu Vatsakatvaka, Sarveshu Sarvasu Kalashayam, Arshas Badyam Chamarabhanja. The simplified principle of the management would be in case of the Shushka arshas, that which is not bleeding, Bhallataka is considered as Agriya. And if there is a bleeding, then Kutajatvaka is considered as Agriya. But in all types of arshas, in all seasons, the takra is considered as the most important, and anything which gives you nourishment and facilitates the expulsion of the stools is considered to be pathya in case of the arshas. In the current situation, the options of the treatment could be either surgery, or the other options could be ligation, rubber band ligation, or it could be laser beam coagulation, or even surgical treatment could be the other options which are available. Now, from the clinical experience, the convenient medical therapy is there, but I say I use the word convenient medical therapy because whatever Sushma has mentioned, they are absolutely practical, true, but practically it will be difficult in the present situation practice. So, in the present situation of the practice, my preference of the drugs, Rasaushadis as well as the available Aushadis would be, in case of Vatajarshas, which are typically the fishery conditions, my prescriptions will be Gandhakarasayana Chitraka Gvati Manibandhu Buddha. Pittajarshas Lakshanas, like where there is a bleeding piles or signs of proctitis, Gandhakarasayana, Kamaduga or on the Bhairavi, depending upon whether the patient has a Atisara Lakshanas or it's the Daha Lakshanas. Then Avipatika Raturna. Kaphajarshas thrombus piles conditions, Sipala Gandhakarasayana Manibandhu Buddha. With this, we can effectively manage the hemorrhoids significantly, and the need for surgical intervention can be reduced. Now, this is about the data of the number of patients I have treated in the span of that every span of 5 years up to around 2019, and the important issue is number of patients are increasing, and the patients who are taken for surgery or intervention procedures are lesser. Medical management of the hemorrhoids has become successful, and it gives you an identity. So that's the Ayurvedic issue. Ayurvedic protocol of treatment can give you a better option in terms of facilitating a less interventional needs in the hemorrhoid management. So and that gives you an identity in the practice in the patients when they come to us, like they may opt to for a procedure which or a treatment where there is no need of intervention, and that need for intervention can be minimized, and the basic principle of Sushruta, that's conservatism of surgery, can be easily practiced. As such, this is about the data which I have shown. With this, let me conclude. It is Sushruta Chikitsa Arshas Chikitsa Nama Shastodhyaya. If there are any questions, we will try to answer and then conclude as such. Right, there are no questions. Right. Right.
Thank you.